Tell us about the staffing at the Boice-Willis Clinic. How many providers do you have?
We have, most days we have 2 providers on at a time. And if you'll...
So you're talking about the urgent care clinic, right?
Right, the walk-in clinic. I'm sorry. Boice-Willis is a whole.
The whole Boice-Willis.
Back on there. Gotcha. So we have well over 60 providers.
60?
We are still growing. We have...
That's impressive. It's a large group.
It is a large group. It's the largest multi-specialty group, I think, throughout Eastern North Carolina. I'm not sure there may... I think we are the biggest single multi-specialty group.
And various locations, too. I mean,
Yes.
not just the big tower that we're used to seeing on North Windsor.
Exactly. We have clinics in Spring Hope and in Nashville, as well as our cluster that's here in Rocky Mount proper. Our dermatologist has a separate clinic.
On Sunset.
And, yes. You had asked earlier about the other specialties that we have. So we mentioned nephrology, which is kidneys. We mentioned dermatology, which is skin. We also have a pulmonologist who also does intensive care medicine. So he spends a lot of his time in the hospital.
Gastroenterology.
In the intensive care unit.
In the intensive care unit, exactly. So he manages folks on ventilators. He does
Really sick people.
Really sick people. Really sick people. We also have neurologists.
And I just mentioned United, but they might not have heard gastroenterologists because a lot of people go to Schellenberg and Anderson and that group.
Yes, yes, we have our gastroenterologist,
Which is gut. Which is gut.
Right, gut.
Stomach
basically,
problems,
here all the way
intestinal
down.
problems. Right.
We have our own endoscopy clinic, so our gastroenterologists do their endoscopies in their own
Colonoscopies, too.
colonoscopy and upper endoscopy as well in their own suite.
And imaging, you've got great imaging equipment there.
We have all kinds of imaging availability, right? We even have an MRI scanner that uses the walk-in clinic's parking lot on Mondays. We have CT scan available. We do ultrasounds. So most of the advanced imaging we can do, as well as the simple plain x-rays that we do even inside the walk-in clinic. We also have, along those same lines, a Medicare certified laboratory. So we do much of our own laboratory work inside Boice-Willis. Now there are some more specialized kinds of tests that get sent out to reference laboratories, but most of the testing that you need done, we can do.
But that's true even for the hospital. Reference testing often gets sent out.
Exactly.
Right.
Right.
Like, that's why LabCorp has been so successful. I mean, they do
Sure.
a whole lot of it. And I think they used to do more of it locally, but then it was found that it could be done internally and get faster results and save that money of having to pay to have it done elsewhere.
Exactly. What we can do internally, we strive to do internally. LabCorp has its place for sure, and if you're going to do rickettsial antibody titers, then you need a reference lab to do them for you.
Because that's something that I will never see.
You hope.
There are, I see some bizarre infections. I have a lady now who had pneumonia 36 years ago, and it spread to her hand. And I took a tuberculosis, not pneumonia, a tuberculosis 36 years ago. She was an intensive care unit nurse, and she caught tuberculosis taking care of this person 36 years ago. It spread to her hand, and I found tuberculosis in her hand. Destroyed her tendons and everything.
You mean still alive in her hand after
It was
all that
living in her hand after, well, it was suppressed in her body, we suspect. And then as she got older, her immune system, as all of ours does, gets a little bit weaker over time, particularly during these times. And who knows if she had a subclinical case of COVID that lowered her immune system even more. And the primitive bacteria that causes it, bacteria-like organism, started growing.
Wow.
It set up shop in her hand, and she had a huge mass in her index finger. So, so we see bizarre things here, but in terms of the laboratory, the esoteric things that are very rare, everybody probably has to send out for. I would probably safe to say that your lab can handle 99.99% of anything that's thrown at it.
Absolutely.
Right. So in essence, it's a full service facility.
It is a full service facility.
Right. That's good.